So, um, you know, I've known Jason for such a long time that, there are things about him that I know are just, has always been the Jason way. And then as he kind of, went through this phase of surgery and chemo, and really even radiation, I noticed some things like the way that he acts as a dad, or even the way that he responds sometimes to the way that Emma will behave. I think sometimes if she's like having a hard time or she only wants me and I'm busy, it's trying to figure out like how does he kind of navigate that piece and really understand. I think he does a really good job of that now. But I also look at it from a standpoint of, okay, but you didn't react as, the way that you did prior to this whole thing. And I think some of it really, honestly, is probably anxiety. I think that sometimes anxiety gets brought on by life events, and not to say I don't have it, but at the same time, I think that reactions and just the way that, he operates, I think sometimes can get a little bit more heightened from just an anxiety level. Um, at the same time, his the way that he listens and remembers things, some days are a little off, but for the most part, he's pretty much the same person that he was before. I think that because I've known Jason for so long, though, I've been able to really understand this is how he was in high school. This is how he was in junior high. This has just always been to him. This is his baseline. And then I've been able to kind of pick up on certain things. But I also think like, radiation does play a factor too. And, he finished radiation about 2 years ago. And, I'm hoping that we don't see any side effects from that, but there's no guarantees. And sometimes it doesn't happen for a couple of years. So it's something where I'm still watching and kind of observing just to make sure, because if there is something, we'd like to try to get on top of it too. So that's kind of also where that caregiver piece comes in also.